Welcome to First Issues. Conversations on climate change have always focused predominantly on the impact of carbon emissions on the environment. Extremely high global temperatures, extreme flooding, and extreme weather patterns have all been the results of global warming that have been attributed to increasing food insecurity globally, animal and human mortality, and overall environmental deprecation. However, little conversation has been on how climate change actually impacts human health and the prevalence of disease. According to an article by the Center for Disease Control, climate change, together with other natural and human-made health stressors, influences human health and disease in numerous ways. For example, some existing health threats will intensify and new health threats will emerge. Needless to say, not everyone is at risk. Important considerations are age, financial resources, and of course, location. To add more insight into this revelation is pharmacologist and consultant cardiologist, Dr. Kiran Bhagat. Doctor, thank you so much for coming on First Issues. We're back here in your office today to talk about global warming, but in the context of human health and disease. We're so used to talking about global warming in terms of the environment, right? But how does that all culminate to the human health and disease?
I think this is an easy one, and it is an important one. And you're right. The talk is generally by environmentalists and politicians, but it's come into our living room, if you like, as doctors, because we're beginning to see the impact of climate change. I know WHO estimates that between 2 to 3 billion people are affected on a daily basis by global warming. So let's unpack this and see what's going on. From a disease perspective, there are multiple issues. And if we just take, for example, the impact of global warming, whatever the causes are, and that's for the environmentalists, what we see, and we've had a torrid summer this year where we had massive drought and very high temperatures, persistently high temperatures. So you can just imagine, and of course, being a developer country, the developing countries are affected most because we are resource poor. And particularly our population in the rural communities. Just take heat, for example. People who are coming into the hospital dehydrated, particularly those that are in danger are the young and the old. The young, because their skin is very thin, as is the elderly, and they're much more prone to evaporation and so if they're not being fed a lot of water, young tend to dehydrate. The elderly have increasing loss of sense of thirst. So they don't know that they're dehydrated, and so they get heat stroke. So we are seeing a lot of elderly being admitted to be rehydrated by a drip. People not drinking enough water, they actually then become constipated. They become constipated. They go to a hospital with intestinal obstruction because the bowels are not moving. We see in terms of the heat, the lack of an agricultural produce. So there's poor food distribution, there's malnourishment, there's a rise in the cost of food because we're importing food. So it's on nutrition, it's on health. Then you see the opposite effect in other parts of the world where there are flash floods. You see flooding occurring in Bangkok or in Thailand or in India or in China, where you now have vast quantities of water, and as a result you got waterborne diseases. We talk about malaria, we talk about typhoid, we talk about cholera. Particularly in the developing world where there's not enough water drainage, sewage systems. So you've got cesspools of sewage sitting around that is rife for cholera. And we've had cholera in this region on a number of occasions. Animals dying because of drought. So you get pestilence. We now know that global warming, particularly as the heat begins to rise across the continent, areas like, for example, the southern part of Botswana that was not generally prone to malaria is now seeing malaria because the mosquitoes are now actually coming down into parts that never did before because of global warming.
But, these are situations that are to some degree out of control of us for at least the immediate future. So in that time, how can we reduce the risk of environmental health problems on ourselves?
I think you're absolutely right. A lot of it transcends you and me and these four walls. it almost becomes a national imperative. It becomes a political imperative, where we've got to, and I'm sure the politicians are aware of this every time they attend UN Assembly meetings. One of the talks is about, the rise in the temperature and the 2 or 3 degree rise and the impact of that. And rich countries are developing wind power and etc. I think our population is becoming more sensitive to it, but I think it's incumbent on our administrators and our government itself to detect the changes of global warming. So in other words, prediction of a drought that's coming, prediction of perhaps a hurricane coming, and flash flooding, in terms of infrastructure, in terms of making sure that we have disposal of water, in terms of making sure that if there is a crisis, we're able to get to it much faster, whether it's drought, whether it's lack of water, whether it's heat, making sure our hospitals are equipped in terms of managing an impending drought or an impending heat wave or an impending flood. I think awareness and measuring is better in terms of managing. So if we can predict this, as we can predict weather, we need to be able to predict that there's going to be a bad agricultural output, there's going to be flash flooding in Mohoritsani or Molepanole, so that people are more prepared in terms of the way they manage it.
If we were to simplify it, global warming essentially is air pollution. Right, but I want us to talk about pollution in terms of human health. Which of the pollutions of the environment are the worst for our health?
I think the two are heat and water. We are sadly affected by excessive heat. So if there's excessive heat, the impact of excessive heat we know that people get more stressed when it's hot. They get more depressed when it's hot. They consume more power because of the air cons and the fans, so it's costly on them. They consume more water, so it's costly on their budget. We know that if there are farmers that they can't go out and water their crops. We know that during our drought season, the temperatures in the soil were so hot that no matter what they did, the plants wilted. So I think it's the heat and it's the water that has the most impact in terms of health. We have seen areas where we have had flash flooding and freak storms that occur over 24 hours, and we know that we've seen the impact of freak storms in terms of hail and the impact of hail on motor vehicles, on housing, on infrastructure, on roads, on our climate. Just this last rainy season that we had those freak storms. So these are things that people don't really need to listen to us to understand. They've seen the impact of global warming on their environment and subsequently on their ultimate health, whether it's nutrition or lack of nutrition, whether it's hydration or lack of hydration, whether it's diarrhea, whether it's if those that did have typhoid or cholera, and those that contracted malaria. This is all directly as an impact of the heat and the lack of water in our country.